And I just kept thinking about them. God, I was supposed to be helping him. It's amazing, to see how far this horse has come. It's not easy, it's hard. We would rather starve them than our horses starve. We want the horses. We want to help them. We want to be able to make a difference in their lives.
The views and opinions expressed in this presentation are solely those of the presenter and do not necessarily reflect the official policy or position of Horse Plus Humane Society, the Full Circle of Life Network, or any of their employees or management. The information contained in this presentation is for general informational purposes only and does not constitute professional advice. Any reliance you place on such information is strictly at your own risk. We strongly encourage you to conduct your own independent research and seek professional advice as needed.
Those 15 minutes might go by real quick, but 30 minutes went by real fast too. But we're excited for our next presenter. She gave up a lucrative career with the USDA to dedicate her life to shelter medicine. She's a mom, she's one of Horse Plus veterinarians, she's all around amazing, and she's coming on stage now. Welcome, Dr. Gina Murray.
Make sure I don't fall off the steps. I do that sometimes. Hello. How is everybody doing?
Serious?
Are you learning lots of cool things?
Yeah.
Good. Are you excited? Yay! We're excited too. Okay, so my presentation is realistic rescue/shelter medicine from a kind of more of a veterinarian perspective, but I love open dialogue, so if you guys have any questions, if you want to wait till the end, I don't have a lot of slides. I left you guys a lot of space so we can talk about it. And I think Dr. Lydia just got back, so if she can help me sometimes, because I do have a teething 18-year-old, so I'm kind of sleep deprived. So bear with me.
5-year-old.
18-month-old. See, case in point. 18-month-old. I have a 3-year-old, a 2-year-old, and an 18-month-old. So, yes, bear with me. I have brain fog. All right, so this is me. I graduated from Texas A&M in 2009 with my Bachelor's of Science in Animal Science, and then in 2016, I went to University of Tennessee and graduated. And then I went into the USDA, as I said, and worked there for 7 years. And I got certified as an equine rehabilitation practitioner and an equine sports massage therapist. And then in January of this year, I got the wonderful opportunity to come here, and I couldn't say no. So, rescue shelter medicine is just regular veterinary medicine in the shelter setting, right? No. I mean, there are some basics that are still the same, but in general, still a developing aspect of veterinary medicine, especially where large animals is concerned, and especially in equine. So that's something that we're working on, figuring out and developing and working together with other organizations like yourselves. So it's a lot of cooperation. So it incorporates not only short and long-term veterinary capacity of health for the individual animals, but also the health of the entire herd that you have on premises or wherever you're housing your animals. So these are some things that we need to think about, the knowledge that we need, the good foundation, so like your facility design, your operations, husbandry, things like that. You have to have people that you can trust with these animals and that you know will do a good job. Risk analysis, I won't talk about the whole list because you guys can read it, but these are the foundation things of knowledge that we really need to concentrate on and think about.
Yes.
So these are our top veterinary considerations, and it's not an all-inclusive list, it's not exhaustive, but it's just kind of like our top things. Like, do they have hoof neglect? Do they have founder? Is it going to be something that's going to be repeating over and over again as a horse metabolic? Is that something that would make them not as adoptable because people don't want to take on a chronic horse that's going to eventually be so painful that they'll have to make a decision? Do they have chronic pain that's orthopedic related, or it could be neoplasia? or it could be something that we don't find out firsthand, and we have to do extensive analysis, and is that something you guys want to take on? So, also, are they unhandled, like the young babies that are just scared, but they're good? Or are they behavioral, like they're actively going after you? We want to save all animals from all walks of life, but sometimes safety is priority, and those animals just will not have a good quality of life if we keep them around when they're so afraid of everybody. And then your veterinarians that you work with can give you treatment plans, like that's our job, is diagnosis, prognosis. We'll talk about that a little bit later too. But is that what your organization can feasibly do? And it's okay if it's not. That's totally acceptable. So veterinarians versus shelter considerations. So we're going to go for health and treatment, prognosis, diagnosis, that kind of thing. And then cost of treatment is going to be up to you guys if it's something that you want as an organization to set a hard limit on and not go past it for anybody, or if you want to make special cases, that's something to think about. And then we also have healthy, like is the horse completely sound, healthy, good mind, or are they healthy but kind of bonkers? Kind of a thing. So, yeah, there's always one that kind of spoils it, but that's considerations you need to make.
Yes.
And then there's capacity. Everyone likes to talk about capacity. It's unfortunately a hard fact. When you're rescuing as many animals as you can, you kind of have to set a limit for how many you can house so you can safely address every animal's needs every day. And on the long term, is it feasible to keep 100, 150, whatever it might be, 20, 25? You have to set a realistic goal and keep it. It's really hard to do, but it's a really important cornerstone of your organization to do. And then we think about how they came in, when they came in, and then their age, health status, all that kind of stuff, their personality. So capacity, we kind of talked about it a lot at this point already, but you want to make sure you have humane spaces for these animals to exhibit their normal behavior, where they're safe, you're safe, and you can safely work with them, and they're good adoptable candidates for the people out there, or if there's someone you're just going to house indefinitely. So we want to make sure we have realistic capacity expectations. So every sheltering organization must acknowledge their capacity and stick to it. So what are the 5 freedoms that every animal deserves? They are freedom from hunger and thirst, discomfort, pain, injury, which some of that, in the veterinary field, sometimes we cause pain in the short term to help the long term, but we're talking about like if they had a fracture and it healed and they're just never going to be the same and they're going to have constant pain from that and need joint injections or oral pain meds and it's just not getting on top of it, that kind of a thing. Fear from distress, fear and distress, and they need to express their normal behaviors. Horses need to be horses. They need to be able to eat grass and run and frolic, all that kind of good stuff. So meeting the 5 freedoms is achievable in an equine rescue setting, but you have to have the appropriate housing, medical protocols, and if you don't have a veterinarian on staff or you don't think you'll have a capacity in the near future for that, you can work, as long as you have a vet you can work with, or you can try reaching out to other organizations to see what they've set up, but you can work hand in hand with your veterinary team to kind of set up realistic SOPs or standard of operations procedures for these kinds of things. We're happy to do it. What are common diseases that veterinarians are worried about? This is not an exhaustive list either, and this is specific to Tennessee, so you have to think about your state and talk to your state veterinarian or your Department of Ag veterinarian should be able to help you with this too. But equine diseases that we report in Tennessee are diseases caused by anthrax, equine infectious anemia, EIA, that's what the Coggins are for, pyroplasmosis, which is mainly from horses being imported from other countries, rabies, and screwworms. And these are conditions that could indicate some of these things, but they're not hand in hand always going to be the same. But check with your state. And then these are not reportable in Tennessee, but are important. And they're from different They're from bugs or like, let's see, like Potomac horse fever can be from mayflies because they carry the organism. And let's see, EPM is from possums that are infected, that kind of poop where the horses eat and then they eat it. So they're not always from the same cause, or like tetanus and botulism are environmental kind of a thing. But these are things that are on our list. Strangles is a big one here. It's not reportable, but if you start having a lot of cases, then you have to worry about incoming and outgoing and quarantine extensions and things like that. And it can be reportable in some states, so you just have to be careful.
Yep.
And then the shelter team has our responsibilities together, because we work as a team. So as a veterinarian, we're responsible for the well-being diagnosis, prognosis of those animals, giving you guys treatment plans. And it's the organization's responsibility to say, hey, I think we can do that, or hey, I think that's way beyond the capacity that we have for this animal, and that's totally okay. We won't judge you for it or talk bad behind your back. It's totally okay. We understand. We're all here for the same goal, to help animals and to work hand in hand. And sometimes we have to make hard calls, and that's okay.
Yep.
So what we all love to talk about is last act of kindness, or euthanasia. Unfortunately, sometimes that's in the best interest of the animal, and it's something that we have to accept and deal with, and it leads to a lot of compassion fatigue and frustration and brokenheartedness, but it's important to talk about it and understand that it does have its place in this aspect of animal care, and it's totally okay. So we as professionals take an oath to use our scientific knowledge and skills for the benefit of society through the protection of animal health and welfare, the prevention and relief of animal suffering, and the conservation of animal resources, the promotion of public health, and the advancement of medical knowledge. And it's up to us as a team to decide whether situations are such that that is the best option for that animal. So these are examples of euthanasia reasons, but they're also not exhaustive. There's many other reasons, but neoplasia, advanced disease, chronic pain that we can't treat. If they're dangerous, that's totally acceptable. If they're going to kill somebody, you really don't want to keep them around or have that liability of adopting them out. You just never know. You don't want someone's child to end up hospitalized or worse because you wanted to give the horse a shot when you knew it already had bad behavior. That's okay. It's okay to make that call. Or if their conditions of rehabilitation is just going to be too exhaustive for what you can handle. If you can reach out to somebody else, say, hey, I have this horse, it needs X, Y, Z. Do you think you can tackle that? Totally cool. But if nobody else is willing to take it and it's something that's going to need extensive treatment, that's a perfectly fine reason to euthanize them. We'll support you 100%. And if they're unfit, they're just not a good candidate for adoption. They might be a great horse, but you know in your heart of hearts that nobody's going to be able to take care of them. That's okay. It's okay to make that call. So what does AAP say about euthanasia? So this is their statement. If a horse owner is unable or unwilling to provide humane care and no one is able to take or assume the responsibility for that animal, euthanasia is a humane reason to treat that animal. And then these are the AAP published and supported euthanasia guidelines from the extensive research they've done. I know that some people have questions about intrathecal lidocaine. When we do that, the horse is completely anesthetized. They are unconscious, they are out on the ground, they don't feel anything. It might look scary to watch a veterinarian do that, or if you have trained technicians that can do euthanasia and do that for them, but they don't feel it. They're just, their body reacts, but they are unconscious. They don't feel it. But you can give agents like the barbiturates, which most of us are, like the Fatal Plus, Euthazol, those kinds of things we're kind of more familiar with. Physical, like a captive bolt, gun, those kinds of things. Intrathecal lidocaine, those are all acceptable, humane, proven ways that are okay to euthanize horses. The unacceptable way is the chloral hydrate. I've never even heard about it or seen it used, so that just lets you know that we don't even consider that an option when we're training young veterinarians to go out into the world. And then in emergency situations where there's serious injury and it's too dangerous to try and get to them to give them a sedative to give these other methods, you can give them a muscle blocking agent, a neuromuscular blocking agent, and then you can go through and do the normal way of euthanasia with the barbiturate or the gunshot or the intrathecal lidocaine. Those are perfectly acceptable, but they are rare and in emergent situations. So it's crucial that we guarantee that these animals have humane euthanasia according to the AEP guidelines, because they are so strongly evidence-based and researched and supported by the big organization of AEP, and that's pretty much where all of your equine veterinarians are going to be members of. So it's really important that we make sure these animals are treated humanely in the last act of kindness. And I know, like gunshot, captive bolt, those are pretty gruesome, but it's better in like a traumatic trailer injury or barn fire or something like that, as long as you have permission. It's better to go on and relieve that suffering than it is to let them lay there until somebody else can come along with the Fatal Plus or the other means. That's all I have. Do you guys have any questions? Dr. Liddy, do you have anything to add? Thumbs up. I know it's sad to end on euthanasia, but it's kind of an important part.
Alrighty, thank you, Dr. Gina.